Tell you about this, hospices across South Africa have been facing major funding and resource challenges during the COVID-19 pandemic. The non-profit organizations found it difficult to operate because many public donations have simply dried up since the dawn of coronavirus in the first quarter of 2020. Newzroom Afrika's Ahmed Kajee went to visit the Stepping Stones Hospice in Alberton, that's in the south of Johannesburg, and filed this report for us.
The Stepping Stones Hospice has been in operation for 8 years. The organization's first patient died on the 5th of December 2013, the same day President Nelson Mandela passed away. Officials at the Stepping Stones Hospice say their major obstacle is changing misconceptions about hospice being a place where people come to die. Cancer patient Absalom Zwane says a hospice allows him to receive dignified health care.
Most of the people who look at these places, the aftercare services, they look as the last resort in the health facilities, but I don't look at it as it's one of the extension of what the government is offering to us, to help us, we people who are very sick. It's not the last resort in life. We can still be healed here. It's not the last resort that when you're here, you're going to die. No. It's not that it's the last resort to die.
COVID-19 has made the process of admitting patients more difficult, with visits also being restricted. Head nurse Sister Maggie Bolman says there are difficulties when families need to say their final goodbyes.
I admitted a gentleman who had a wife and 4 children, and we had put the policies in place that only 2 visitors were allowed. And then I had to make a choice. If I was going to follow the rules, I would have to choose which of this man's children were allowed to visit him. And I advocated for that patient because really it's not fair to him or to his family to not be able to spend time with him. And as he reached the end of his life, all 4 of his children and his wife were at his bedside, his children on the bed, and they were able to say goodbye to him in the most dignified and comfortable way possible. It's really difficult if you have to choose who's allowed to visit a family.
Cindy Eges, who has passed away since this interview took place, said facilities like a hospice has given her an extension on her life. Cindy was diagnosed with stomach and esophagus cancer.
I'm treated with absolute respect. I'm treated like a human being. I'm treated like somebody who still matters, even though everybody knows that I'm dying. Everybody treats me like there's more days coming, you know, that I'm not dead yet, which is a great, it's a great advantage to how I feel about me on a daily basis.
Cindy says hospices need to be cherished by society.
These facilities need everything that can be given to them. Seriously, they do. Like I've said, you're treated here like you're a part of a family. There's no, excuse me, my mouth is dry. There's no discrimination. Everyone is treated exactly the same way. These facilities need to be given everything that they can be given. They need to be honored. They need to be cherished, because without this place, and I'm not being melodramatic now, I was on death's door. I was on death's door 2 months ago. And as you can see, I may still look like I'm there, but I'm a step further away than I was 2 months ago.
Cindy passed away on Tuesday morning. Candles are allowed to burn for 24 hours in rooms where patients have passed away. CEO of the Stepping Stones Hospice, Tertia Berger, says funding is needed.
We need help. We need funding. We need to be acknowledged. The fact that we're non-profits doesn't mean that we don't employ professional staff. Our staff are all highly qualified and educated. They have extra training in palliative care, and they have these incredible hearts.
For Newzroom Afrika on Channel 405, I'm Ahmed Kajee in Alberton.